Hi, I'm Dr. Glenn, resident veterinarian for Vet and Pet Direct. I'm here today with Mr. Beau. He's going to help out with a senior pet check and what goes on at the vet when you take your pet to the vet clinic. Beau's one of our staff member Beck's dogs. He's 14 years of age. He's had a few troubles in his life, as do most 14-year-old dogs. He's pretty chill and calm at the moment, so we'll crack on and see how things go. So a senior vet visit for your pets really starts at home when you're thinking about booking in your appointment. Some pets like the vets, some pets have had multiple bad experiences at the vets and don't like going to the vet, so sometimes there's a conversation to be had about do you just book your pet in to go to the vet, or sometimes there's some pharmacological interventions that can help make things less anxious for pets. If you've got a history of anxiety with your pet at the vet, just have a chat to your vet and see what your options are. When you rock up to the vet, we're going to weigh in, and weight really important for older pets, that we manage that and we record that over time to see if there's any ups and downs going on. When you go into the vet consult room, it's a scary place for some pets. We like to have lots of treats on board if they will if they'll take them, and ply them with treats, and history is a really big part of a vet exam. It might take 5 or 10 or 15 minutes to take a good history for a pet, particularly if the pet hasn't been a regular presentation at the vet clinic, to find out all the things that we need to know about older pets. So just going through an actual examination, what it looks like. I'll have a listen to their chest, have a listen to their heart before I do anything else, because sometimes their heart rate goes up the more poking and prodding that I do. So hearts is really important in both dogs and cats. There's certainly an increasing incidence of heart troubles and respiratory troubles as we go along. As pets get older, we're listening for heart murmurs, heart rates, heart rhythms, are the lungs inflating symmetrically. There's a lot that you can hear in that chest. If you then move forward to our head, obviously Beau's had a few little troubles with his eyes over time. He's only got one eye, and we removed that a bit over 12 months ago because he had some eye tumour troubles and then had some complications with eye ulcers and other bits and pieces. So he's a pirate, which he's coping very well with, which is awesome. But if you start looking at, okay, what's going on with the face, we're looking at eyes. Cataracts are really common for pets as they age, both dogs and for cats, where you get cloudiness in the lens of the eye. Sometimes that stops us being able to assess further back in the eye, but we examine the retina with a little device basically to see what's going on with the retina. Particularly cats get blood pressure problems, and you can see changes in the retina in cats that give indicators of high blood pressure and other disease processes going on. Dental disease is really common with pets at any age, but the older they are, the more likely they are to get dental disease. Beau's got a little bit of tartar here. He's had his troubles last year with his eye, and he's probably coming up to needing a dental again. He's had some teeth removed, and that's pretty common with older pets. You need to start thinking about, okay, what can I do to keep my pet's teeth as healthy as possible? Dental disease is a really big health issue for dogs and cats. If they've got bacteria and infection in their mouth, you'll end up with heart valve troubles from infection in the mouth. So it's not just because it's uncomfortable. They're actually, they're getting infection, they're getting poison in the system essentially from what's going on in their mouth. So dental exams are really important. Ears. Lots of older dogs go deaf. There's very few older dogs go deaf because of something that's actually happening in the ear canal. They certainly get ear infections, and occasionally they'll get narrowing of the ear canal, but most of the time it's an ageing change that we can't do anything about. But you certainly want to make sure they haven't got chronic ear infections. When your dog's getting patted by the vet, a lot of the time we're feeling for lymph nodes, so little lymph nodes underneath their jaw, in front of their shoulders, behind their shoulders, back down in their groin, behind their knees. So lymph nodes, we see enlargement of lymph nodes from, unfortunately, some tumour troubles, some other health stuff. When we're running our hands over them, we're feeling for little lumps and bumps, which are really common in pets. A lot of lumps are benign and don't cause any problems. Most of the time they should still be investigated by your vet to make sure that there isn't any other troubles going on, that they are benign, not spreading, not cancer troubles. We're feeling for their condition. Particularly fluffy dogs or longer haired dogs and cats, it's hard to tell, are they actually fat or not? Have they got good muscle mass or not? Beau's got a little bit tucked away for a rainy day. He's still got a waist under there. You can still feel the outline of his ribs. So he's in pretty good condition, probably a little bit fat. And a lot of dogs, that'll go up and down. But weight is one of the most important things as far as older pets go. The fatter they are, the more likely they are to get health troubles and have health troubles, unfortunately. So diet and exercise is really important. Muscle mass wise, are they symmetrical? Have they got one shoulder that's got more muscle than the other? Has one back leg got more muscle than the other? Prominent dorsal processes, their spine sticking out is really common in dogs or cats that are losing weight. Sometimes that's over the whole body. Sometimes dogs and cats will have disc troubles here and they'll have lots of muscle here, and then they'll start to fade away here, and that's a sign they've got some disc disease in places. So we're just assessing body weight to some extent, but it's mostly their condition, because body weight can be still a bit fat, lacking muscle, so their weight stays the same, but they've actually got some underlying conditions going on. We'll palpate lots of stuff in the abdomen. A lot of time we'll spend a fair bit of time palpating their abdomen if we can. Fat animals is more difficult to palpate bits and pieces, but we've got the liver up underneath the rib cage. Stomach you shouldn't really be able to feel. Enlargement or abnormalities of the kidney sometimes you'll pick up. You'll feel the spleen in the bottom of the belly, feeling their bladder for bladder stones or thickening. Their intestines, a lot of pets you'll be able to feel if they've got thickened intestines, have they got a big colon. Entire male, sometimes you'll feel a prostate enlargement at the back of the pelvic canal. So there's lots of stuff to be gained by having a good feel of their abdomen. Rectal examination, particularly on entire male dogs, really important for prostate health. If you've got any lymph node enlargement, sometimes you'll feel enlarged lymph nodes on a rectal exam as well. So there's lots of different things that we can tell down in that department. And also anal glands, you can get anal gland troubles with tumours sometimes. If your dog's been scooting, obviously we often check anal glands for sign of blockages and that sort of thing. How often should your senior pet be examined? Be guided by a veterinarian. Most vets will say at least yearly from 7 years of age at a minimum. I'd prefer to see older pets every 6 months for an examination, and a lot of the time that will include your full exam, which is the base level of what should be going on. Yes, there's treaties there, isn't there? Look, blood tests and urine tests are sort of a really important thing where we can do a test and pick up on problems earlier than when you start to see physical symptoms. So most pets, at least yearly blood work and a yearly urine analysis is a good idea. The urine side of things is mostly concentration of the urine, how dilute is the urine. If it's becoming more dilute over time, you've got an early indicator of kidney issues, of diabetic troubles or something else going on. The earlier we catch small problems when they're happening, the better chance we've got about changing the course of that disease, so that's really important. So that's basically the overview of what a vet check should look like for a senior pet. Every one of those steps you can find different bits and pieces that need other diagnostic tests or workups, but that's sort of a minimum of what should be going on at your vet. I hope that helps out. Thanks guys.